All right. Welcome everyone to Skin and Bones podcast number 2. We have committed to a second episode. Can you believe it, Zach? It's November 21st, 2021.
It's kind of shocking. I mean, you've called me like twice this week, and that's already too many times. This is getting crazy.
I know, but it's fun, and it's definitely something that we're going to continue to do at least weekly. Yeah. So if this is your first time tuning in, my name is Dr. Peter Gust, and this is Dr. Zachary Hill, Zach Hill. Howdy. And this is We Make Up Skin and Bones podcast. So a couple things to talk about today. Pretty excited about some of the feedback we got as far as on the social media and everything. Everyone's been really interacting, even a lot more than I thought we would get across all the social media platforms.
A little scary.
You think?
Yeah.
So one of our followers and med school classmates wanted us to kind of weigh in. Andrew Viscara, he's a pediatrician, wanted us to weigh in on our opinion regarding the financial kind of burden of private medical school. And it's definitely something that sets you back for a long time. Loma Linda was well over $50,000 a year when we went for all 4 years. And
that's just tuition.
Yeah.
That's just tuition.
Yeah. So it definitely adds up. A lot of people don't have help from other people as far as living expenses, and let alone fun money to go out to eat or go do some activities, and even go out to have a nice vacation when you have a couple of days off or anything like that.
Totally.
So what are your thoughts, Zach? What do you think about, was it worth it?
It's funny that you say this, because I have my Loma Linda School of Medicine graduating class of 2017 mug with all of our names: Andrew Viscara, Peter Gust, Zachary Hill. So you know what? It's amazing. I'm the first one in my family to go into medicine. I think last time I stated that I was the second generation to go to college in my family. And so this is all kind of a new thing, and especially medicine is a new thing to me. And so when I went into it, I just had a passion for the human body, and I really took a backseat to the education because I loved it so much. But then you go into medicine and you find out what you want to do for the rest of your life after 4 years of medical school. Really, after 3 years of medical school, then you have to make a decision. And it's not like nursing. Both our wives are nurses. You know, you can be a peds nurse, work for 2 years, and then like go and get training and go to cardiac ICU, which is mostly adults, all adults, right? So it's really different. And when you go to private schools, I mean, I didn't have a chance. I got into one medical school. I got accepted 2 weeks in. So shout out to Andrew Viscara. Probably got like 5 other applications and stuff. But, I was one of the last ones in. And so for me, I had to take it and run, and I didn't have any other choice. But, when you're looking at it, I kind of relate it to this, right? And I know that Andrew's in pediatrics, and we can go into, the compensation rate through Medicare, Medi-Cal, and that's a whole other podcast.
Yeah.
And that's the business side that you really don't learn until you get close to being done, right?
Yeah.
But, I went to Fresno State as an undergrad, and, Fresno State is not a very big school. It's not very well known. But when you put it up to the USCs and Notre Dames, the Harvards, when you do that for undergrad, really what you're buying is a connection and a network, because all those classes are still taught across the nation at these undergrad schools, right? Same thing with medical school. You're still getting those educations, and you still have to have the required curricula taught to you that is accepted by the Medical School Association. I know this because I sat in on a lot of those things when I was the president of our class. And so it doesn't matter like how you shape it and how you shift it throughout your 4 years there, you have to meet a certain amount. So the things that we got at a private school, as far as Loma Linda is one of the only Christian medical schools, is completely unique. And so really, I think that's the network that you're buying into, is that unique network that is within the Seventh-day Adventist hospital system that you can grow out and go with. And that's only the really thing I can kind of compare it to in my own mind, right?
Sure.
Because I didn't have many options. I didn't have any options. I had one. And so, but yeah, I mean, you go into medical school, you come out, I know he's married to a doctor. It's challenging because you think, it's really dramatized about doctors in Hollywood. You give up your 20s to sit at a desk and study, and you collect a lot of debt, and you don't have weekends off, and you don't get to take your girlfriend or your newly wife out to these nice things, right? Like it's not that traumatized. It's really a lot of sacrifice. And so I think when you're looking at it from the specific question of private school versus, a public school or somewhere that's a little bit cheaper, I think that it's what do you want? If you want to go to a private school and go into that system that has an outreach where you're trying to get in and become a professional for the rest of your life, then I think it's totally worth it in the end because you're going to be happier there. But if that's not the case, and I think you need to really think about why you're going into it.
Oh, I like that. I like that viewpoint. At least for me, thinking about the financial aspect of medical school, it goes to kind of years of productivity lost. You are not getting paid for the years you're in medical school, so you're losing that productivity that you could have been having making a normal salaried job, or even like working getting paid hourly. Productivity years mean a lot when you're not getting paid, and you're studying. Studying is your job. You're paying to study for those 4 years while you're in medical school, in the hopes that you're going to have a high earning job and be able to get out of debt later on. But it's a little more to the story, because people don't think about all those years that people are working, just out of college even. And even in college, there are people who decided not to even go to undergraduate, and they got a job doing as a welder, or like some sort of craft that they picked up, and they're making money all the way along. So if they're smart with that money and they're investing that money and using it and letting it work for them, all those years of productivity, it takes a while for doctors to catch up as far as financially. Even though you do make a higher income than most at the end of your training, you still have to catch up to all those productivity years lost. And the one of the best books about this is written by the white coat investor. He's a emergency room physician who wrote a book and talked a lot about personal finance and things like that. He actually went through the military for his training, so that's a whole nother kind of facet to this whole conversation as well, because you do have a lot of recruiters coming at you, and we have a lot of great friends that decided to take this route to go into the Air Force, to go into the Navy, and they'll pay you a stipend while you're in your training, as well as pay off your training for you. So it's kind of, do you want to have to answer to debt, or do you want to have to answer to kind of be committed to service to the Navy, the Army, whatever it may be? And that's kind of another facet, and more just, you have to look at it on a personal level. Which one do you see yourself kind of more likely to commit to, as far as like on a personal level? So that's kind of my take on it.
Yeah. And I mean, we can go back to compensatory rates and everything like that. But I think right now, if you were to go into medical school and you're like going in, you were choosing between medical schools, you had private and public, but you were thinking along the lines of something that's not as highly reimbursed, like orthopedics or plastic surgery or dermatology or something like that. And you had the chance at taking a school that was $28,000 a year for tuition, versus a school that was $50,000 a year for tuition. But the school with $50,000 of tuition, you almost guarantee you have a networking system afterwards in order to be a physician in one of the hospitals. Like, which one would you take? Like, I'm putting you on the spot right now. Like, which one would you take? If you knew you wanted to do like family medicine, internal medicine,
I would probably go the public route for that. Yeah, the public route, because it's not going to change a lot of things, and we can go into different ways that we have options for paying off our loan, as far as public loan forgiveness as well, and working for nonprofits and working for public entities. So that has to be taken into account too. And whether you're planning to pay off your loans fast, slow, or just pay like the income-based repayment plans that we have the option of doing, basically paying 10% of our discretionary income until forever, basically.
Yeah. I mean, it's I one day we'll go into a podcast of what it took in our 20s to go through medical school, and that how hard that was mentally, seeing friends who were making money and starting families and going on vacations and playing golf on weekends, and they just didn't understand that you were studying all day all night. That's all you were doing. And then you get into residency and you're working all day and all night, and we're not working. Guess what you're doing? You're studying. So it's like, and all of a sudden, you're 33 years old and you're like, I got a bunch of debt, but I love what I do. Like, I'm one of the lucky ones, right? I love what I do, and I know I'm gonna love what I do for the rest of my life. So
yeah,
Andrew, I hope we helped you. I really do. And
or
so
just
I'll drink out of our Loma Linda class 2017.
or just at least got a few thought-provoking conversations going for our listeners who don't know much about the financial aspect of medicine and going to medical school and kind of getting behind and getting in a bunch of debt when you don't have family that can help you out, pay for living expenses, or help you out with your education. But thanks for the feedback, Andrew. We appreciate it. Just want to remind everyone again, we're open to conversation topics across the board within reason. Keep it within reason, but definitely won't limit your feedback and anything you guys want to hear about. So we actually had another comment on our Facebook page by Claudia, one of my wife's cousins that I married into. I got a chance to get close with her. She lives in Loma Linda as well. She wanted to know our thoughts on how to incorporate complementary and alternative medical therapies into practice. Kind of left it open-ended for us. For people who don't know what complementary and alternative medicine is, essentially, we're allopathically trained Western medical doctors. So that's not the only type of medicine out there. That's just the way it is. We're trained to treat disease processes in a very systematic and protocol-driven way. When we have something called evidence-based way, and those protocols come from evidence. And basically, we have this thing called standard of care. Standard of care essentially means if you have people who've trained in the same field, you should be doing what 99 out of 100 people are doing for a patient in a certain instance. And if you're deviating from that too much, then you're not practicing first-line standard of care evidence-based treatment.
Yeah. And so when I look at alternative care, a lot of times this comes up when a patient asks you, well, what about cat's claw? Or what about the big topic, especially in California, CBD and THC, right? As alternative medications. What about a chiropractic? What about acupuncture? And to me, when I look at it and how I practice, is those are great questions. And going back to our first episode, the humility to say, you know what, I don't really know a lot about that. But then what the good physicians do is they look at the evidence to support their decisions and how they discuss things with their patients, right? Because how you discuss things amongst us, right, in normal communication is different than when it's your patient, because when it's your patient, you're driving it through evidence-based medicine. And that's what leads you up to that standard of care, because it still is the practice of medicine, right? Because people have different opinions about how to treat things. And so, I read a lot about the cannabinoid pathways in the body, and, they're okay studied. We know that there's a pathway. We know that there is anti-inflammatory aspects to it. So I don't understand the pathophysiology and the pharmacology behind it completely. And I don't think it's been studied completely. And I know that the risk to benefit ratio is not that high. So patients can have benefit with very, very little risk. So as long as they're not rubbing cream on a newly incision that I made, I'm like, hey, go for it, right? Like, if that's what makes you feel better. Obviously, in California, when it comes to marijuana, just say, hey, I'm not the police. If it helps you, great. Just please don't drive a vehicle. It's just like, those are the things that you have to say. And I think it'll be interesting though, as we go through and we find out more and more about these pathways. But the other things that come up, acupuncture comes up, and there actually shows that there is some benefit for non-operative spinal pathology. There is benefit for chiropractics for non-operational spinal pathology. But then it goes down this path where you have a chiropractor who's not the allopathic pathway, who's trying to fix something that is not fixable by spinal manipulation. It needs decompression. It needs surgery, right? Like. So I think just having open and honest conversations, and the hard part about this in today's day and age in medicine is it's all about how many patients you can see in the clinic in a certain amount of time.
That is completely true.
We can't have this long conversation because you have 40 patients you have to see in a day. And that's a lot when it comes to documenting and billing and all those things. So I think it's one of those things where I think when a patient brings it up, or if you have a thought about it, if you have a question about it moving forward, just to write something down and go home and read about it. PubMed is out there. Everyone has access to it. You should have access to journal articles that you frequently cite, like I have. AOSSM, which is sports medicine, Journal of Orthopedic Trauma, JAOS, which is Journal of American Academy of Orthopedic Surgeons. Like, I'm a member to all of those. So that's where I go to for my baseline knowledge, because that's what is widely accepted as the standard of care for patients. But you can go down a pathway and go to the India pain, medicine journal. There's journals for everything.
Yeah.
So that's a convoluted question too. I think you just need to, whenever you have a question, if you're a clinician, if you have that question and you don't know because you haven't been exposed to it, read about it and just find out what's out there, but do it in a medical standard that has objective terminology, because we have to give objective answers to patients.
Yeah, Claudia's in medicine, so she understands the whole scientific process and everything like that, and appraising evidence. I think it goes down to definitions though too as well. The definition of complementary medicine, the reason I kind of talked about standard of care treatments is if we're practicing something that's complementary, meaning doing this alongside of standard of care treatments. If we're not doing the first standard of care treatment, then you're doing your patient a disservice. If you're only doing the complementary aspect of it, you got to say that you have to have both for it to actually have a benefit, because we'd lose our license if we basically only promoted complementary medicine, because that's not what our license is in. But at the same time, we can look into our research as far as like, will there be interactions if this other treatment plan is complementary to the first line therapy is happening? Are we gonna hurt our patient? Because overall, we took an oath to do no harm, and you're doing harm if you're letting a patient do something that you think could actually harm their overall clinical progress. So I saw this all the time. You can view all the VA patients bringing in their therapy dogs. That's complementary medicine. All these patients,
and they're the best.
Yeah,
they're such good boys.
I know, they bring them in there, and that was one of the coolest things ever, because there would be these seizure dogs at the VA, and these dogs actually can sense when their owners are about to have a seizure, and make sure and alert them to it and tell them, hey, you need to lay down, you need to put yourself in a safe spot, you need to stop driving the car, things like that. And I was blown away by that. That's considered complementary medicine. It definitely needs to be a conversation you have with patients though. You need to establish what the first line treatment is that has the most evidence. And then as far as if they're asking you about incorporating complementary medicine, you just be honest with them. Like Zach was saying, you just need to make sure that you're looking up the evidence and the data behind it. Make sure to avoid stigmas, because patients smell that a mile away, and they can tell when you just don't like something. But it's not fair to not like something and not look it up. That would be my take on it.
Yeah, and if you want to know if it's complementary medicine or not, just see if your insurance will pay for it. That'll be your answer.
That's completely true.
And that's the dirty truth, right? Like, that's the dirty truth. But the thing is that I think that the reason why we have standard of care is because complementary medicine does not have the medical evidence behind it to support it. It's kind of like in one of those areas where there is no significant difference, or a p-value that's greater than 0.5, or if you look at a meta-analysis, there is no significant difference, right? And so that's where complementary medicine lies. And so a lot of insurance programs will say, well, if there's no difference, then why are we going to pay $800 for a therapy, right? So a lot of it becomes out of pocket. But the reason why we practice what we do is because there are multiple papers that show there are clinically significant differences on this medication for your risk of cardiac death versus stroke. All these things are, or from a surgical perspective, this is why you fix this fracture this way. You can fix it one of 15 ways, but this is why we select to fix it one of these 3 ways. This is what the pluses and the minuses are. In dermatology, this is why we cut this out. This is why we biopsy this at this stage. I mean, we have the data to support the reasons why we do it, right? But the practice of it comes from, well, out of those 15 ways, which way is most comfortable with me? Which way do I think is going to be best for this patient in this situation? And which is going to ultimately, which we all came in this field to do, what's going to give them the best outcome, because I care about my patients, right? We all care about our patients.
Yeah. What's going to interfere with their quality of life the least, and promote it the most. It's a fine balance for sure. There's so many different types of complementary and alternative medications. And then you get basically the definitions of homeopathy and, allowing the body to heal itself. A lot of times people don't either want medications or they want the least amount of medications, and they want to know their options as far as the body actually healing itself, which is completely fair and valid. But like you were bringing up before, it's difficult to have these conversations when you're having external pressures to see patients very quickly.
Yeah.
And it's completely out of your hands as far as that goes a lot of the time. So
which leads
our
us to our
job
first
is
question, right? Of how do you get reimbursed? Is it worth it? Right? Like, yeah, we want to help patients, but at the end of the day, we sacrifice our 20s. And I think doctors should be paid more, but we sacrifice a lot to be compensated. And we have to see a lot of patients in order to do that.
Yeah. And if we're not having time enough to even talk about the first line therapy and explain all the side effects and the risks of the first line therapy, and we're jumping to just having a conversation about complementary and alternative medications, then that's difficult, because our job as allopathic Western trained doctors is to give the best option first for each specific patient. So Zach brought up a meta-analysis. A meta-analysis is just a paper that's basically combined together of a lot of other papers. So it's like it shows the best data and evidence towards something. So whenever we're looking for, should we do this instead of something else, then we look for a meta-analysis, because it gathers all the papers together that are regarding a certain condition or treatment protocol, and it tells you which one works, which one doesn't, and it has the most amount of patients in the studies, so that you can have less bias and a lot of other things like that. So just for those of you who don't know what a meta-analysis is.
Yeah. And for those of you who are in medicine, I wish I spent more time studying and understanding evidence-based medicine classes, because I use that every day, and you'll use it every day whenever you read a paper for the rest of your career.
Yep.
And I just was like, man, I got to go back and learn about the difference between a ANOVA and a t-test again, because I forget there's one small thing in there, but it's really how you decipher the papers. And yeah, as Peter was saying, so meta-analysis, like for instance, let's say you have drug A, and drug A has been shown in 15 papers to be, significantly more improving for the patient. And in 10 papers, it's significantly not. A meta-analysis takes those 25 papers and it says, okay, what else is out there in the world and has the same confounding? And we talk about power, which is how many patients are in it to make a significant difference or clinically acceptable difference. So you gain power through that. And it shows out of all these papers that are looking at one thing, is there actually a difference in all of them? So
exactly. Good explanation on that. All right. Well, Claudia, hopefully
that's how nerdy I get right there. That's about it.
Yeah. Then you just make bones straight.
That's right. Maybe I'll wear my scrub cap one day.
All right. So hopefully you guys got a little more look into what we think as far as complementary and alternative medications and treatment plans as well. Thanks for the input, Claudia. Thanks for listening. Yeah. So Brian White, another one of our friends, he had a question, what we thought about multi-level marketing. And Zach said that I'm going to get to take this one.
So the one thing, you're going to take it, but the one thing that I have to talk about this from a perspective of medicine is that you go to medical school to learn medicine, and then you go to residency to go into your specific training to learn how to do that for the rest of your life and how to do it very well and efficiently and safely, especially when it comes to being a surgeon, right? There's so much surgical techniques. I operate on every aspect of the body, every extremity, including the spine. There's a lot of anatomy, there's a lot of pathology, there's a lot of instrumentation, there's a lot of understanding to know about that. So my 5 years was dedicated to that. Nowhere along the line did anyone tell me about medicine and marketing, money and marketing and all these things. It's like, you go into this world, and I actually got a contract the other day. And so I was looking at it. I'm like, I need someone who knows what they're doing to look at this.
Yes, you do. Yeah, we can talk about this off the podcast, but
yeah, for sure. Watch out. Peter's going to come at me.
Yeah. So multi-level marketing, I mean, some people basically get a little confused when they think about multi-level marketing. They think that it's synonymous with pyramid schemes. It's a little bit deeper than that. Multi-level marketing is basically just a marketing strategy that utilizes personal relationships with people and gets kind of people to actually recruit their friends and family initially and promote products in order to teach people to sell those same products. And the key there being there needs to be a product. So that's where the definition, I guess, is important, because you need a good product to be selling. If you're not selling a product and you're just selling hype, then that's basically a pyramid scheme where it's making money, people at the top money, and it's just basically lying to people. But there's lots of good multi-level marketing companies that actually have products. Probably the most famous one in my field would be Roden and Fields. Roden and Fields actually created Proactive, if you've ever heard of that acne medication as well. They're two doctors. They still practice, I believe, at UCSF. And they created Proactive, which was just an easy way to treat acne. It has active ingredients that we know treat acne, as far as topical antibiotics and retinoid medications. But with their newest line of skincare products, Roden and Fields, they took more of a multi-level marketing approach with it that promoted common people to kind of sell their products and do their reviews and tell people how it works. And they're basically, it's a more personal way of marketing. So I think there's a lot of bad stigma behind multi-level marketing, because people don't understand the definitions between pyramid schemes and MLM. You have to be very good at being extroverted and telling people and actually believing in the product. Well, that's one thing. It's one thing to sell something that you don't believe in, and it's another thing to actually believe in the product and sell it to your friends and family and get them in the same business and have a home business that is based around multi-level marketing. So I don't know. I don't have a problem with it at all. There's a lot of people that do, and I think it's an educational gap and not understanding what it is, essentially. But you can make a lot of money with it. Just make sure you're actually having a product and you're not just selling hype to people, because I think that would make it a little bit hard to sleep at night. Roden Fields is good because they take simple skincare and they make it very, very easy for people to use, and for certain things that people don't like, and their marketing is really good and appealing to their clientele. And that would be my MLM example for dermatology, at least. But there's so many different types of MLMs out there in different fields and different products as well.
I think the only thing for like multi-level marketing, I mean, it's really hard in medicine. I think you're right. You have to have a product that you believe in, right? So for you, it might be a skincare product or some sort of Botox that you use for your cosmetic things, or whatever it is, right? For me, I know that probably moving forward, the best marketing for me is firsthand experience, right? Like, how was I as a physician to my patients in a community, right? And they will go and tell someone else. And even if you didn't perform surgery, it's being just a physician who shows that they truly care about what their product is, which is their profession. And that goes a long way in the community, I think. So I think it's a great question. And it's something that is easy to look into, but I think you hit it right on the head, though. You have to have a product that you believe in, whether it's yourself as a surgeon, whether it's a product that you're selling to your patients, and you can expand from there. And there is great room to move, because why else would a patient go somewhere else if they can come to you? Why else would a patient use this product if they can use one that their friends use that works?
Yeah, I think people get mad because usually the people at the top of the multi-level marketing setup are making a ton of money, and they're making more money than the people who are just starting out in it. But I mean, when you think about any type of business, if you're starting, let's say if you're starting your own dental practice or dermatology practice, and then you teach new doctors how to do what you're doing, they take over your patient care, and then you're just overseeing them, developing protocols, dealing with the back end stuff, and then attracting more doctors to that's the same thing. That's the same thing.
It's because the people at the top incur all the risk.
That's part of it too.
That's why they should make that much money, because they put in the time, they risk loans, they risk everything else, where everyone else, they just show up and try to sell something. And if they lose their job, they can go find another job. If the person at the top loses their job, they lose everything.
That's a good point. Yeah, it really depends on the instance, but that's a good point. As far as taking on the overhead of starting a medical practice, and taking on the overhead of like marketing for your practice and training new hires and things like that. If they decide to leave, then that's on them, but you spent a lot of money developing them as well, so you should see some of the profits of that.
Totally.
That's interesting.
Good question though.
Yeah, that's a good question. So we were kind of hanging out with Justin and Amanda, one of my good friends from college this weekend. They flew in from Idaho. It was a good time.
I bet you had a lot to
But
say.
oh yeah, but we had a lot of good conversations. But I mean, we went out to dinner and we are just like looking around, and we're both married, so we're like, would just like crash and burn if we had to date people in in this day and age with all the apps and all the try and
So
find someone that you are compatible with. We lucked out and we just like had a good conversation about that.
So Megan asked me that, is Cynthia around? But I
Yeah.
mean, like how it's like, so I met Megan before any dating app, right? We met in
Hmm.
undergrad, and I know you met Cynthia a long time ago as well. So
Hmm.
there weren't these dating apps, and you're right. I don't like, honestly, I'd probably be the creepy guy who would like, if I wasn't married. So Megan, when you watch this, I love you so much. You're the only one for me. But if I weren't married, like I don't think I could do a dating app. I don't think I could do that. I would, like, if I saw, because obviously the first thing, right, is physical attraction. Like you have to find someone physically attractive,
Hmm.
right? But I'd probably like wait, find some excuse to wait, and then just say, I don't know how to do it. And Megan, I brought this up with Megan, and when she hears it, she'll laugh too. But I'd probably just say, hey, I find you attractive. I'd like to get to know you more. Can I please take you to dinner? And
Hmm.
I'd probably be that creepy guy. I'd probably get that stigma. But you know what? It's better than a guy who does this all day and just swipes left and swipes left and swipes left, because you know what? It shows initiative. And I think that's a big thing.
Yeah.
Would you
I
do
don't
it? Would you
know.
do it? Would you do that? Would you do that? You do the apps.
I'd probably do the apps.
Yeah, you would.
Yeah. I would
Yeah.
definitely do the apps. I wouldn't be
You
good at
would.
the apps
Oh,
because I
you
got
go
nobody to
through
tell me what angles are good because I take awful photos of
yeah,
myself and other
you
people.
would go through every filter to find one that actually made you look good.
It would just have like those little Facebook things where they just have I'm vaccinated in the back or like a Green Bay Packers logo in the upper right corner. Something stupid
Great.
like
So I'd be the creep who waits for them outside the gym or whatever,
that.
and you'd be the person who are like, they'd sit down and be like, "Am I getting catfished right now? What is going on?" It's perfect.
Oh
It's
my
perfect.
goodness, it's so funny. That reminds me, there's a show, I forget it's on one of my buddies, Femi, was showing us this show called The Circle. And it's like one of those useless waste of time television shows, but they're basically all living in the same complex and they make social media accounts and they don't meet these other people and they have to figure out whether they're catfishing them or not just basically by DMing them and like messaging them, and it's completely ridiculous. But I never finished watching it. I watched a couple episodes, but
Yeah.
it's called The Circle and it reminds me of
Yeah, I need to find some. I finished my my show Dope Sick, which is really good. Oh, it was
yeah,
so good.
I'm gonna
Great
start it.
cast. It was really good.
Yeah.
But that's interesting. Megan actually showed me a relationship counselor. It was a YouTube thing. It was a relationship counselor who tried to pair people up who were either dating or sleeping with each other, which I don't agree with the whole premise of it. But I was like, there's no way she's gonna be this good, right? She got all of them right. And I was like, whoa. But she, like, you know, she'd try to match people up and then she'd be like, you know, hug them, you know, and like, if you don't know someone, you go to hug them, it's like, this is really weird, you know, but if you're
Yeah,
comfortable with them, and she saw that, and I was like, ah, she's like, actually, she's like putting people on the seat, and it was pretty good. So I have to say
that's
that.
interesting. Yeah, you
But
told me that you watched The Bachelor with Megan. So I have to admit that I was watching Keeping Up with the Kardashians with Cynthia, and they went to a cuddle therapist, and that just reminded me of that.
hey,
They
there's
basically
nothing.
they made them just hug complete strangers for like 20 seconds at a time.
Okay, if you go to a place like that, run. I think couples counseling's great though. Okay,
Yeah.
so
Okay.
if you fail to continue to know the person who you're going to spend the rest of your life with, something's wrong. You got to find out more about them every day. And I'm just happy that I have someone who constantly reminds me of that when I am so busy in my work. And she goes, hey, stop and sit down and spend time with me. And she literally has to say that because of who I am. I'm like, go, go, go. Like I'm tunnel vision like this. And she's like, I need you to sit down and just cuddle with me right now. And I'm like, okay. I'm like the dog. I'm like, okay. So sorry, pets.
Oh man, nobody else is gonna be laughing at this, but I'm glad that we can.
But
So
well, one of the things that I wanted to bring up and talk about is like,
yeah.
you know, I've been watching a little bit more TV because it was my last week of my last rotation.
Hmm.
And Megan's family, we had Thanksgiving this weekend. We do it a weekend before because I'm not a big fan of Thanksgiving, and it's easier. The flights are cheaper, and it's very easy for everyone to get up and take time off of work and everything. So we've actually been doing it the last couple of years, and it's been really fun. But what I've been noticing is that there's like a complete corporate bastardization of Christmas that gets earlier and earlier and earlier and earlier. Like I remember seeing my first Christmas commercial for like Old Navy, like November 10th. Like I just feel that we are in such a corporate world now that, and it's nothing about what the message of Christmas is, whether you're a believer or not. The message of Christmas is that there was a gift that was so great that was given to the world. And it's a constant reminder of us to give to others. And that's if you look at it from like theological worldview. Our theological worldview is a lot different of what Christmas means to us.
Yeah.
But it's just giving gifts and sweaters are half off and this and that. And I just, it almost like really like, I don't know, it like broke my heart a little bit because one, I hate shopping. I hate shopping for Christmas. And two, I was just like, man, it's so early. And I'm like, there's no message about what this holiday is really about, depending on where you look at it from. If you look at it from a secular worldview, if you look at it from a religious worldview. And I don't know how you feel about that, man. Have you noticed that? Has that even been on your radar?
Not in that aspect, but I think I'm desensitized to the capitalistic world we live in. So it doesn't matter the theme. It doesn't surprise me. I'm desensitized to it because I didn't even notice it. But at the same time, does it surprise me? No. If there's money to be made in America, people are going to do it. They're going to do it. It surprises me that it's not starting like in August. It's at least it's November.
They actually studied that and they said it wasn't beneficial.
Really?
No, I'm just kidding. I haven't looked at that, but I'm just saying, like, I don't know. It kind of broke my heart a little bit. I'm not gonna lie, because like every Christmas I look forward to because it reminds me of the greatest gift that was ever given. And no matter which way you look at it from, that's why we celebrate it. There's certain things that are gifts that can never be taken away, and that's time, that's talent, and that's treasure. And depending on how you look at those three things, right? So
I'm going to name this episode Time, Talent, and Treasure. Write that down quick. Look at us. Who'da thunk it?
Who'da thunk it? Oh man, how about those pack though?
Oh, let's not talk about that.
It's Sunday, by the way.
That's just rude.
At the beginning. It's Sunday. It's Sunday night. It's late for Peter. It's about to be 9:00 in Texas.
It's not bad. It's all good. We gotta keep this rolling. Skin and bones. The train is just leaving the station. Okay.
Yeah. I mean,
it was a tough day for the Pack. Lost on a last second field goal. Kirk Cousins should have been picked off 3 times, but the Packers DBs just basically forgot their hands today. So it's all good.
Defensive backs aren't known for having the best hands, dude.
It's wake up. Yeah.
Hey, Peter, coming close only counts in horseshoes and hand grenades, buddy.
What?
Sorry. You got to win.
Horseshoes and hand grenades. What?
It's the only way you can come close, and it's a good thing.
Oh,
think about it. Think about it. Think about it. All right, there it is.
Oh, you.
How have we been friends for like 9 years, and you've never heard me say that?
I think I have, but it's just desensitized, man. It's just.
You need to wake up, Dr. Gust.
Oh man, when do you think the housing market's gonna cool off, or do you think it ever will?
I hope to God it's after we figure out what we're gonna do with our house here. If anyone's looking for a house in Sacramento, California, Megan and I might be putting it on the market when we go away for our fellowships. Give us a call, please. Thank you. Inbox.
I'm gonna put your address on. Definitely not doing that.
No, dude, I don't know. I don't know. Megan's mom is in real estate and she does very well. Honestly, that's probably the person we're gonna sit down and talk to the most about it. I don't know if it's. I think it is gonna bust at a certain point. I mean, just looking at trends, right? Like it's gonna go down at a certain point, but gosh, it's at an all-time high. And if it continues this way, we're hoping that it does until through July when we're looking to sell. So, I mean, got to take advantage of the market, right?
Yeah, we're in on a year lease here, but we're definitely looking around trying to find a place to buy because We're going to be in Austin long term, it looks like, and I'm loving it.
You think
I
so?
am loving it. Yes, sir. Yeah, come meet us over here.
You think? Well, no. Well, I know that you were in Dallas, and Cynthia's family's in Dallas. Would you think about like moving to Dallas, or do you think
Nah,
Austin?
man. All I'm focused on is building my patient base here.
That's good, man.
Treating patients
That's great.
to amazing patient care, and just like it's gonna be awesome. I can't wait to just build that longitudinal relationship with my patients, see them.
You hear it here first. Dr. Gust is in Austin to stay.
Oh, put it on the board.
Down on that one.
Put it on the board.
Love it.
The weather's been kind of.
Where's Dr. Hill gonna go? I don't know. Where's the breeze going today? I don't know.
Bro, you're coming to Texas.
You know, I would love. We're not gonna talk about politics until episode 89 if we haven't killed each other yet. We're not doing it. We're not doing it.
Oh man.
You know how I feel about California. But there are great things in California. Number 1 and 2 being my family, my wife's family.
And Yosemite and Tahoe.
Oh, beautiful Tahoe. We were just there. It was so great. It was so beautiful.
Cynthia and I really miss the hiking.
Yeah.
We got nice kind of hill country over here in Austin on the west side, but not bad. For a nice walk with Amanda and Justin along the river, the Colorado, and downtown. It's pretty nice. And it's not too cold, not too hot right now. Not even that humid in Texas. I guess it is November. Hopefully we don't have a deep freeze again like they had last year and they ran out of power. So anyways, anything else you want to bring up?
Well, nothing, man. That was kind of what was on my plate today. And, you know, it's one thing that's going on in Megan and ours life. Just got done with my total joint arthroplasty service. So I'm moving on to hand and upper extremity, which I'm looking forward to so greatly. It's going to be so much fun. I love being the chief on hand and upper extremity. It's going to be so great. I love taking care of microvascular things. And
look at you. You just sound so smart. You're just so smart.
I am going to be looking forward to educational opportunities at every aspect of my life, because you know what? When you're on call, anything can come in through those doors, and you got to be willing to treat them.
I don't know. The face I'm looking at right now is a face that's ready to handle it. So I know you. But that's the same face I use with my golf game, and that doesn't work. So
oh no, it doesn't.
It's been a little cold out, and then Cynthia took my card.
There's excuses. There's excuses. Here they come. That's okay, guys. I've been hearing this for 4 years. Oh, my golf.
The more balls I hit, the farther out of bounds they go. I always had a quote that I said that I practice golf and go to the driving range for the lone sake of the safety of others, so that I can, if I actually do go golfing, nobody gets hurt too bad.
Yeah, but I actually went to a golfing range with Peter, and it was by a freeway. The first question he asked was, how tall are the fences? 50 feet? Yeah, Zach, we're good. We can stay for a while.
Oh, man, that's too good. Did you see that the Staples Center got renamed?
No. What? I didn't know. I didn't see that.
So it's renamed Crypto.com Arena now.
Really?
It's going to be. It hasn't happened yet, but they just signed a $700 million deal to rename it Crypto.com. And Crypto.com is actually something I've invested in personally, but like it's based out of Hong Kong. So we'll see how that goes, but it's definitely, they have the marketing push right now. If you watch any NFL game or like anything like that, you'll see Crypto.com in the background, and they're basically they're going to be like a PayPal of crypto. They have wallets on there. You can trade between different cryptocurrencies, and they have a lot of different options. They have a lot of options to do what's called staking, where you put your money in there and you get paid interest in the coin that you have staked. It's basically like a CD. And you just keep it in there, and they pay you after 3 months for keeping it in there. And then they actually have a Visa card where you earn rewards in crypto.
This episode of the podcast is brought to you by Chris.
No, dude, I know, right?
It sounds like you're seriously. Come on, guys. But the one thing I took away from that, because I don't do crypto stuff, is that well, not yet, I guess, but. So you're like, oh yeah, it was like for $700 million. Have you seen the amount of money that our government's been spending in like the last 2 years? Okay, just think about this for a second. You're like, oh, they bought it and they renamed a center for $700 million just for the name.
Mm-hmm.
Okay, That is an unfathomable amount of money. Okay, so $700 million. You know what's $300 million more? $1 billion. You know what we're spending? Trillions of dollars. Like it just blows more than 999 billion on these things. And like they're getting thrown around and they're like, oh, but don't worry, this won't go into inflation or into the debt. I'm just sitting here going, in what world are we living in right now that we're talking about this much money? Like, would you ever imagine that much? That doesn't exist. I'm sorry.
Can't even wrap my mind around $1 trillion as a number.
Yeah. Like Duck McScrooge in those old things, you know how he used to dive into the vault of cash coins? Like that doesn't exist. Just like $1.2 trillion doesn't exist. It's unreal. Like I just can't. Like I remember they're like, oh yeah, the House passed the bill, and I was just like, for the infrastructure bill for 1.2 trillion, and I was just like, trillion, 1.2 trillion.
Oh my goodness. Yeah. I thought it was interesting.
It's mad. It's mad.
Yeah. Money is just, I mean, $100 bills made out of the same paper as a $1 bill. So,
hey man, hopefully, you know what? I'll cheers to hopefully the inflation goes up and our loans stay at the same rate. So it's like, oh, it's, $200,000. It's not that much anymore.
Adding on to Andrew's question, I get like refinance offers. I get like 3 or 4 in the mail every single day. I mean, talk about desensitized. I'm like, oh, yeah. 3 or 4 offers to refinance my loans like every day.
Yeah. You need some fodder for the bonfire in the backyard. So I like those, actually. It's pretty nice.
I love it. How's your puppers doing?
Jasper, he's a good boy. He is doing well. We had our family photos today. We did ugly Santa sweater. We did Christmas photos today, and we did ugly sweaters. And I'll wear it one day, and you will love it. I'm not gonna. I was about to say it, but I'm not gonna give it away.
Are we allowed to put this up on the podcast social media?
Megan was actually thinking about making it one of our thumbnails.
We need to. Oh yeah. You should do the thumbnail again. Here, do it. Let me screenshot you real quick.
Gosh, it's really awkward to do it from this angle. Sucks.
All right, got it. All right. So yeah, the cats are doing good. So Zach has a dog. I'm a dog person as well. But in medical school, at some point, Cynthia was like, we need a pet. So I was in a rotation. I was like, yeah, do you mind going to find a pupper today? And she came home with 2 cats that I'm allergic to, Harry and Coco. I love you.
Time out. Roll that one back. You went to go get a dog and you came home with
2 cats. It wasn't me. It was Cynthia. And then she was like, I'm so sorry, but can we keep them? And then the cats were like running around the house, little kittens, like the first time we got them. And Cynthia was like, did I make a mistake? Oh, she's going to hate me for talking about this. But I was like, no, we have to keep them. And they're the cutest. It's going to be an
interesting podcast next week. Yeah. When she watches this.
Shout out to Bronson Leclerc for breaking our cats. He didn't hurt them, but he basically, when they were kittens, he held them and made them very approachable to anyone, and they're not mean, and they just like let you pet them. And
the thing that people need to know about Bronson, one, is he's Canadian, and everyone knows that Canadians are very nice. So he probably gave them some fries and gravy, and everything's great. He was like, oh yeah, I'll let you know, this is going to be great. You're going to be a great kitty cat.
In Alberta, the way we do things is our terrible Canadian / Wisconsin accents strike again. But my allergies haven't been too bad.
Yeah, well, I love you. I gotta go. I gotta sign out. Yeah, I still got work to do tonight. So good spending time with you. Skin and Bones #2 in the books. Yeah,
I like it. Thank you guys for listening. And as usual, just reach out to us on Facebook or Twitter, Instagram, with any of your thoughts on the podcast, feedback. But until next time, Skin and Bones is out.
Out.